Hello friend, welcome to this video. In this video, I will share with you all the important points that you need to know before preparing your ERAS application. Even you have done your ERAS application right now, I can assure you that you will be able to pick up points that will help you to make sure an outstanding ERAS application. If you are new to this channel, welcome. My name is Dr. Farzana Hoque. I'm an assistant professor of medicine and currently practicing in the US. So what is ERAS application? This is Electronic Residency Application Service. Why it's important? Because your ERAS application is representing you. You cannot go to every program and tell them how wonderful you are and how you truly deserve that interview and be matched to their program. Instead of you, your ERAS application is communicating with the program. It's truly representing you. As an interviewer for now nearly 5 years, I can tell you that for every year when I interview residency candidates, I at first look into their ERAS application. When program director, program coordinator, they are reviewing the applications, and from thousands of applications, they are trying to find out that 200 or 300 people, at first they look at ERAS application. So in order to get the interview, before the interview, to create a positive impression, everything matters truly depend on your ERAS application. So I say it that this ERAS application is either you use it to get interviews and then ultimately matching, or lose it. So truly choice is yours. I must have to say that I'm not a professional resume writer. I'm sharing with you about my experience that I have learned when I was in your shoes, when I was preparing my ERAS application. I have learned from my mentors, from the seniors, and then now as an interviewer, what I look for in the ERAS application and which things I see positively and which things I see negatively, I will share with you in this short video. So one thing always remember that you cannot apply to programs until you submit your application. And after you certify your ERAS application, you cannot change the information except your personal address. So the message is, make sure that every word in your ERAS application is correct before certifying it, because once you certify it, you cannot change it. And remember, other people's fault always be easily seen by us. We may not see our fault, but other people will catch if there is any mistake, any spelling mistake in the ERAS application. So what we will learn in this brief video? First, I will share with you all the important points in the ERAS application that will guide you to write every section of your ERAS application. Then important points to remember when you are writing your personal statement. After that, how you can obtain excellent letter of recommendations. And finally, I will share with you some tips, some take-home points, which I strongly believe will be useful for you. So first, there will be email address part in your ERAS application. And I will highly advise you to use a separate email address for your ERAS application, because you will get a lot of email from the program. Either it could be acceptance or rejection, and it's hard to find that right email from your other emails, and sometimes it's just so much time consuming. So my advice will be, use a separate email address only for your ERAS season. When you are creating this separate email address for your residency season, be professional. Do not go for fancy. Sometimes I see, do not go with fancy like robinhood@gmail.com, or like for example, my name, Farzana Hoque. If I just put fh@gmail.com, people do not have idea who is this person. So I will highly recommend you to use your first name and last name in your email address. That sounds more polished and professional. Secondly, when you are using your address, never ever use any mailing address. And it is always useful if you have US mailing address, because it gives the signal to the program that you are already in the US. However, the reality is if you are currently outside of the country, you cannot change it, and it's okay. But do not use PO box. Then certification, you can use certifications like advanced cardiac life support or basic life support. If you want to do this certification, you can do it through online, and you can do it through American Heart Association. The cost could be around like $100 to $150, depending on which course you are doing. Then one important point will be medical education. And as you already know, year of graduation is extremely important to get the interview and ultimately to be matched. However, if your year of graduation is more than 5 years, can you change it? No. So which things can you do? First, strive for higher USMLE scores. Okay, so right now, if you are applying for and you are done with your steps, okay, that's fine. If you have high score, that's wonderful. If you do not, you cannot change it. So what are the things you can do? Because I can tell you, I know there are a lot of other candidates who matched even with low score. So what did they do? First, they did hands-on clinical experience, externship, research experience. It could be volunteer. Good letter of recommendations, where the letter writer is telling that which things you did and how you will be successful in the residency program, and how the residency program will be benefited after accepting you in their program. And then publications. I know publishing is not always easy. It takes a lot of work. However, aim for higher things. And then you can try to do some like poster presentations. We will talk momentarily. The next section will be in your ERAS application will be medical school honors or awards. I will suggest you to be truthful here, because the pupil, if you have awards, that's wonderful, document it. If you do not, you cannot change it, and be truthful, because in my experience, the people who are reviewing your application, they have long experience and they will understand if something is not truthful. At the same time, if you have award, highlight it, because they want to know. So you should take this opportunity to share all your awards and recognitions. Membership. So which organizations you could be member? American College of Physicians, the medical student part is free. Then American Medical Student Association and American Medical Association. Full disclosure, I do not have any financial relationships with any of these organizations. If you are not member with any of these, if you are coming from Bangladesh, you can be member of Bangladesh College of Physicians and Surgeons or other professional societies in Bangladesh. Or if you are from India, Pakistan, Nepal, have membership at least one physician society, because it shows that you know how to work with the team. You want to be a part of team, which is important in your residency. So membership is important, and you can go couple of organizations and have the free membership. So then they want to know your current or prior training. It could be any post-graduation training. If it is 1 month, 1 year, 5 year, document it. Even if it is 1 month, never ever miss the opportunity not to document it, because it shows that you want to learn and you took initiative to hone your skills. So regardless of the time, document it. One of the important part of your ERAS application will be experience. And I will go very detailed here because I cannot stress enough how much important it is to get the interview. So there will be a column called work. You can highlight your clinical work, or if you taught medical students, residents at your home country, you can highlight that. Then volunteer will be any unpaid work would be volunteer. And then research, if it is paid, you can put it under work. So what I did when I prepared my ERAS application, all the clinical experiences I put under the work, and then I tried my level best to do externship or hands-on clinical experience. So hands-on clinical experience are always preferable by the program because it shows that you know at least a little bit how to work in US health system, you know how the hospital system work. So they always prefer that. And program feel confident to hire you when you have at least few months of clinical experience. And you will feel confident too. I can tell you from my experience that when I did shadowing, observership, and in contrast, when I did externship, the hands-on experience, I felt much more confident after I did the hands-on clinical experience. So it's not only to brighten your resume, it also to boost up your confidence, which is most important in any stage of our life. So then observership, you can mention, I understand for last 2 years for the COVID, getting externship in US hospital, it's not easy. It's not completely open yet. So it's always something better than zero. If you do not have externship, if you did observership or shadowing, document it under experience as work. So the description box will be available for every experience. So how can you fill up that description box? The main important point you need to focus here that you have to document what did you learn or which skill did you develop from that experience. So which things can you document? First, case presentation. When you are shadowing a patient or doing hands-on, you may carry 1 or 2 patients. So present the case to your attending physician or resident, and definitely you can write down that you learned how to present a case. Because as an intern resident, every day you have to present a lot of case, which is very, very important. Then electronic medical record. Majority of the US hospital, I should say like almost 99% of US hospitals now use electronic medical record or EMR. So if you are working with EPIC, Cerner, document it, because learning electronic medical record, it's very important. Clinical knowledge through didactics. Didactics, like for every hospital, every teaching institutions, they have morning report, noon conference, journal club, grand rounds. These are the events they organize for educating their interns, residents, and faculty. So document that if you are doing any clinical experience, join and then document that what did you learn from those didactics. Then time management. You can always document that you have learned how to manage your time, because time management is a skill that every physician is still trying to learn, including me. Then teamwork. Medicine is a teamwork, regardless either you are in Bangladesh, India, or you are in Canada or US. So you can tell that how to communicate effectively, how to collaborate with the physical therapy, social worker, occupational therapy. You have learned about it. At least you have general overview how these team dynamics work. Then patient counseling. Maybe your attending give you the opportunity to counsel a patient who have diabetes, or if you are doing shadowing, maybe you saw that how your attending talked about goals of care or end of life discussion, or talked with a patient who is going to be hospice. So all these things you can document under your description box. Very important point. When you are writing your description, always use active verb, because active verb will give power to your writing. If you do not know active verb, here I added some examples of active verb. If you need more, Google it. So think that you wrote one line that I did it. If you compare it with I performed, I conduct, I managed, which line is sounding more powerful? Absolutely, the line where you are using these action verbs. So always try your level best to use action verbs when you are writing your description box. The description is very important, and be truthful, because these people are reviewing a lot of applications. It's for your own benefit. Be truthful. Then do not oversell it. Do not tell that, okay, I discharge this patient. Do not undersell it, because it's very important to show that what did you learn from that rotation and how you will implement that knowledge skills that you learned in that rotation after you match their program. Do not keep the description box blank. It doesn't look good. You have to always tell what did you learn from that experience, because that is one of the most important thing they want to know from you. Be clear and concise. Very important point. When you are writing the description box, do not do more than 3 to 5 points. What I did when I was writing my ERAS application, I did around 2 to 5 bullet points. That's it. So one part will be research or presentation. So you can do the presentation at conferences. There are a lot of conferences, and it does not have to be only in the US. It can be any medical conferences at your back home. So it could be poster presentation or oral presentation. And remember, it does not have to be always in the US. The presentation or research, the presentation, I mean, it could be oral or research. The poster presentation, not the case presentation, because it's totally different. And if you are doing a research project, you do not have to be the principal investigator. You can be always only data collection, or maybe you are reviewing the data. Whatever you are doing in this project, tell that specifically. Now I will move toward volunteer experience. You may think that, okay, I do not need to do volunteer. It's not important. It's not right. Volunteer is also important, because as physician, we are expected and we should have some contributions to our community, and one of the easiest and effective way is doing volunteer at our free time. It does not have to be all medicine related. You can mention how you contributed to your community. Maybe you are a member of Red Crescent Society, or you are collecting money for flood victims. You are helping to organize the community health fair. Or if you taught somebody, it does not have to be always medicine related. If you taught some like school children, that could be also highlighted under the volunteer experience. Mentoring, if you mentored some junior students, you can also highlight that. Languages, I saw that in this current ERAS form, they made the documentation of language much easier, which I truly liked. So you can mention what language you know, and they have very specific way to mention that whether are you native or how much fluent you are. One piece of advice: do not oversell it. For example, I had one candidate one time who told me that he is very fluent in Spanish. So when this candidate went to other interviewer, that interviewer was fluent in Spanish, and he asked him the questions through Spanish, and the interviewee got caught because he was not understanding what the interviewer was asking him. So be truthful, because language could be sometimes a way to start the conversation, and people can find out, particularly if that interviewer is fluent in that language. Other awards, be conservative about using your high school awards. I believe this should be significant awards, does not have to be medicine related, but you do not need to say that, okay, I got a scholarship during my 5th grade. This should be something more advanced than that. And show the awards that shows your enthusiasm, your cultural mind. For example, for me, I told that I got award in music competition. Hobbies. You may feel that, okay, I'm a physician. Why I need to tell about the hobby? I do not have time for it. As human being, we need at least one hobby. I know, although everybody is fighting for time, hobby is very important. And do not keep this section blank in your ERAS application, because hobby could be a very common topic to start your interview, because interviewer try to start with a topic that you will be more comfortable and you will enjoy to talk about. And it shows that how you are as a person, because remember, before you are a physician, you are a person first, and every program wants to hire an active, a cultural minded person, a person whom they can work easily. So if you like to play video game all the time or like to watch Netflix all the time, you can like that. There is nothing wrong with it, but this is not the right place to document it. You should tell about some hobbies that shows that you are a creative person, you want to be active, or at least you want to utilize your brain during that time. It could be something like, walking, jogging, climbing, hiking, poetry. Something shows that you have cultural mind and you have something interesting that you can talk with other people. Spelling, punctuation, grammar, I cannot tell that how much important it is. And another important thing is article. Make sure that you are using the right article. Remember, the ERAS application does not have any spell check. It will not tell you about the wrong grammar, wrong spelling. So it's ultimately 100% up to you to check all these spelling, grammar, article. I cannot stress enough how much important it is to proofread. I can tell you at the same time that it's not easy. After some time, you will feel bored because proofreading, revision, it's not a fun thing. However, it's very important to make sure that your ERAS application is neat and does not have any mistakes. You can use some software that will help you to fix the grammar or spelling. And if you are not sure, always double check it or at least ask someone who will know it. And nowadays, the Google is truly our best friend. If you do not know something, try to Google it and try to figure it out. Do not capitalize all the letters, because see this line where I put all the letters in capital, it's very difficult to read. So use capitalization cautiously and according to the rule. The first letter of each line should be capital, not all of them. The picture, you may tell that, okay, this is silly. Picture is nothing important. I do not agree with that. And I can tell you, program director will also agree with me, because professional picture is very, very important. And it requires timing and planning as well, because your professional picture is giving them the first impression. And one tips that when you are requesting letter of application, letter of recommendation from your interviewer, use your picture in that CV. You can use maybe in a small size. However, the rationale will be when you are using your picture in your CV, it's giving them your impression, and that create more connection when they are writing about you. And in this way, they will remember you more as well. So rule of thumb for letter of recommendation, always request early, because physicians, irrespective of where they are practicing, people have less time. So request early, because it takes time to write a good letter. It's always better to waive your right to see the letters and upload always up-to-date letter. For example, if you have a letter that you got last year and you did not match, you should not use that same letter. Tell your letter writer to change the letter, to change the date, and then upload it. So never ever upload the old letter. You can use the same letter, however, tell the letter writer to change the date and then upload it. Give your CV to your letter writers, because it will help them to write a good letter for you that will have all the important information. So it's very important to giving your CV to them before ahead they are writing your letter. Letter from physicians who are practicing in the US is always preferable. My goal from this statement is not to disobey the skills, knowledge of our physician colleagues who are practicing outside of US. I always respect their work, because I'm an international medical graduate and I came so far with all the advice and guidance from physicians who are practicing outside the US. However, the reality is US health system, when they are reviewing your application, if you have a letter of recommendation from a physician who is practicing in the US, they know this physician's credibility. They know this physician, okay, what this physician is practicing, what is their specialty, rather than a physician, then another country. So your best bet will be getting the letter of recommendations from physicians who are practicing in the US. If you do not have it, then it's different situation. Then you can get the letter from abroad. However, first try to get letters of recommendations from the physicians who are working inside the US. Then when you are asking for letter, have good balance of clinical and research letter. For example, if you are applying to a community program and you have all the research letter, that will not take you so far, because they need someone who has clinical knowledge. On the other hand, if you are applying to a university program, at least even try to have good balance of some clinical and some research, because maybe you will do research in that university program, but remember, at first you are getting hired for clinical work. So you should have balance of both letter of recommendations which are coming from clinical work as well as research experience. Now I will talk little bit about personal statement. When I was applying, somebody told me that do not worry about personal statement, people do not read it. Absolutely wrong statement. I can tell you that how busy I am when I am going through a candidate's application before interview. I definitely take a glance at personal statement, like 100%. People may not read line by line, but they will definitely have a glance at your personal statement. So what things you can do that when the interviewer is just looking at your personal statement, it will catch their eye and they will read at least for a few minutes. Your goal is to catch their attention so that they will read your personal statement, and never ever undermine the importance of personal statement, because doesn't matter how much busy an interviewer is, they will at least glance your personal statement before going for your interview. Before they interview you, they will go through your application and personal statement. So always do it within one page. People may say 1 to 2. I will tell 1 because people are busy. Nobody has time to go through more than 1 page. This is the perfect opportunity to explain any red flag or any gap. For example, if you have low score, or if you got attempt in any steps of your USMLE, this is the perfect place to address that. For example, if you have low score in step 3 and that time you had some family emergency, you can tell them that how you had this emergency, but even though you did not give up, gave the exam, although you got the less score, however, the family emergency did not stop you for giving this exam. So somehow if there is any red flag or any gap, you should highlight it. This is the perfect opportunity for do that. Do not write it in the ERAS application, because in the ERAS application, if you write the personal statement, it's so much time consuming and this is not a good place. So what I did, I wrote my personal statement in an Word file, and then I copy paste and put it in the ERAS application. Proofread it, because when you are doing copy paste, if there is any word is missing, same thing, ERAS application will not give you any signal because it does not check the grammar or any kind of errors. So it's truly your responsibility to make sure that every word is there. So you have to get some documents from your medical school. Like if you are international medical graduate like me, you will need medical school performance evaluation from your school, as well as medical school transcript. One thing I can tell you from my experience and from other people's experience who shared with me, always request it early, because it truly takes long time to get this paper. I know this is unfortunate, however, this is reality. So always request it early so that you can upload it much earlier. Otherwise, I can tell you, it will be so stressful if the program is starting to review the application and your MSPE or transcript is not there. And these are so valuable documents that you must have ready before they open your application. So request it early. So supplemental ERAS application, this is something quite new. ERAS has started for last 2 years, including this year. And I reviewed the supplemental ERAS application to give you the accurate information in this video. So I found it really a good way to share some important information. And I saw that there are some specialty are participating in supplemental ERAS application. And I know that a majority of our international medical graduate apply to internal medicine, psychiatry, and pediatrics. And all these three specialty have the option to use supplemental ERAS application. So in this supplemental ERAS application, you can highlight what is your most important experience, which thing you want to highlight, and also you can tell that what are the area will be your first choice. I found it very useful, so review it and I will recommend you to utilize it. So ERAS application submission, the first day, always the important day. Always do it on the first day, because first day is truly the last day. Because program, they do not like collect all the paperwork every day. They try to do it on like few days after the first day. So always do it on first day, otherwise you will miss this opportunity. Important points to remember here, that ERAS application, if you want to write a great ERAS application, it will take great deal of your time, energy, attention, and dedication. So be prepared for it. This is not something very quick. Secondly, do not try to do it in a single attempt. This is not a single attempt thing. I can tell you, if I do ERAS application again, it will take me a lot of time too. So take your time. The valuable sources, again here, I do not have any professional relationship with these associations. However, when I was candidate, I truly used their resources, and those are absolutely free. So I will recommend you to use these free resources, AAMC and American College of Physicians medical student section. You will see that they have CV, personal statement sample, they have lot of resources, webinar for international medical graduates. So what are the important points for ERAS application before I finish this video? Will be always gather a lot of research and clinical experience. This is very important. Make sure that you save the application before you leave it, because if you do not save the application, if next time you come, all your valuable work is gone. And one more thing here, that when you are writing your ERAS application, at least show them that currently you are doing some work, right? Because if you are submitting your application in September, you should do some work during that time, because if that month is empty, that truly do not give any good signal to them. Use active verb, as I discussed earlier, particularly for your description section of work, for your personal statement, that gives power to your writing. When you are using the description, always go through 3 to 5 points, not more than that. And revise, revise, and revise. I cannot tell that how much important it is to revise to have outstanding ERAS application. I hope you found this video valuable. And if you have any questions, any comments, put it under the comment section. I would love to hear from you. If you are new to this channel, please subscribe to this channel, like this video, share this video with your friends, with your colleagues, whom you believe will be benefited. If you want me to make a video on any particular topics, please share it under the comment section. I would love to make that video for you. And I will see you in the next video. Until then, I wish you all the best.